CEO Live Talks.
I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change, and these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. I'm your host, Dr. Swannie Jett, and welcome to CEO Live Talks. Today, I have a good friend, Miss Jennifer Hancock, to the show.
Good to see you.
Good to see you. So before we get warmed up, as I customarily do, I ask people, where did you grow up at, your family structure, and just give me a little bit of history.
Sure. Well, I'm a lifelong Louisvillian.
Okay.
Born and raised here. All of my family are still here.
Wow.
I went to St. Pius Assumption,
Okay.
and then off to UK, and then back to Louisville as soon as I could. And so I'm really proud to get to be part of a community where I was born and raised and where my family still lives. Grew up with a wonderful family. I have 3 siblings, and all of them are here. And it's just wonderful to get to continue to be part of such an amazing, vibrant community.
That is good. I like that. And then you went to Assumption, because that's the first thing everybody asks is what high school you
Right. I know. I go ahead and get that out of the way because I know that's the follow-up
That's the
question, right?
follow-up
It
question.
is.
What high school you go to? But tell me a little bit about your mother and father.
Yeah. So very hardworking Catholic people is how I would describe them. That's the headline.
Okay.
Loving, supportive, wonderful parents that raised my siblings and me. And I'm blessed to have them still with us. And I'm very close to both of them, and love that I get to enjoy a really strong relationship with them as an adult, and for them to be a big part of our family still.
So I know they're proud of you. Which one of them gave you the idea to really hang your hat on social justice? Because somebody had to inspire that.
Yeah, well, both of my parents, because of the Catholic social teaching, really believed in giving back and tithing and being contributors to not just the church, but the community. And so that was a role model for us growing up, from both of them, actually. And that was instilled in all of my siblings and me. Each of us selected different careers that were all about helping others, from law enforcement to social services to running a business as the office manager, then really building a community around a small business. So each of my siblings and me are true testaments of the spirit of community giving and service and social justice, for sure.
So when you brought it up, so what is your sister, that brother, sister?
2 sisters and a brother.
2 sisters and brothers. So what do they do?
Yeah, so my older sister runs a small business, and
You gonna give them a shout out?
yeah,
Give a shout out.
Dr. Harness's dental practice on Gagel.
Okay.
My brother retired from law enforcement and now works in security and served our community in law enforcement throughout his entire career. And my younger sister works as a therapist in family recovery court here in Jefferson County.
Wow.
And so each of us have different career paths, but a lot in common. And certainly being engaged in our community and giving back has been a real important part of our family upbringing.
Yeah, I like that. So you go to UK, and then you think about social work.
Yeah.
Why social
Yeah,
work?
well, I actually started thinking about social work as a sophomore in high school because I was in a program that was called ACTS, which stands for A Christian Through Service, and had an opportunity as a student in that program to do service work in the Smoketown neighborhood. And specifically at that time, there was a Presbyterian community center.
It was.
And
I remember that.
I got to be part of that community and got to build relationships with young people who looked different from me, but we had so much in common. And that experience alone, along with some of the encouragement of teachers who were really aware of my love for community and love for service and nurtured that in me, led me to declare that I wanted to be a social worker.
What year was that at Presbyterian?
This was back in the 90s, in the early 90s. And I remember a woman there, Timmy Sorrow, who was this amazing social worker who had dedicated her life to working in Smoketown and giving back to that neighborhood and that part of our community. And I just learned so much from her, and that was just a real awakening for me that I could be part of communities and be part of service in a way to bring people together, that our differences are really superficial, that we're really so connected.
Oh, we are connected.
And I loved that learning that I had as a young person.
So while you were there, I was in Smoketown, working with Ben Tobin at Presbyterian.
Oh my goodness.
I had a program called Wings to Soar, where we rebuilt bikes for kids. Shepherd Square to over there. So that was in the 90s. I still got the newspaper clippings.
We were probably crossing paths with each other. Yeah.
But I didn't realize Presbyterian is no longer in business no more.
Yeah.
Until a few years ago, I saw that.
Mm-hmm.
Okay.
Right.
So you graduate from school.
Yeah.
And you had grandiose ideals, and you settled on what?
Well, I actually selected a specialty in clinical social work and became licensed as a therapist.
Which is why you got your business now.
Right. So I started a private practice in mental health counseling. I've had it for 24 years. And that's been a big part of my professional life that's been really meaningful to me, because I knew as my daytime career took me in more of an administrative path, staying true to the clinical roots of what drew me into the field and getting to work with individuals and families directly was really important to me. So I've had this private practice on the side for 24 years and then found my way through a variety of social service organizations until I met my predecessor, and she invited me to join her at Volunteers of America in 2007.
Right. So mental health has been at the crux of society for the last few years. At least it's come to the forefront. What was your experience dealing with patients during COVID?
The debilitating effects of social isolation were so pronounced, and I think all of us can relate to that in some way. But for many of the people that I see and serve, just being so isolated creates so many mental health impacts.
Right.
And so finding ways to get connected and engaged in a world that was shut down was really at the forefront of our work, and supporting people responding to all the changes that occurred so rapidly around us. And for folks who were already struggling, it affected all of us, I believe, in some way. But for folks who are already struggling, just that additional layer of stress that's so chronic and all-consuming can be really debilitating. And so that was certainly at the forefront during COVID.
Yeah, I remember, and I don't know what made me do this during COVID, but being an epidemiologist and tracking patients down that had COVID or that I had to put them in quarantine, all of a sudden everybody had their cameras off.
Yeah.
Right? So I said, I need you to turn your cameras on, my staff, so I could look at their eyes and listen to their voice. They tended to have a tone of voice. It was out of character. Did you notice those signs as well?
At Volunteers of America, we run mostly residential programs, not exclusively, but most of what we do is in a residential setting, whether it's a homeless shelter or a drug and alcohol treatment center or homes for individuals with disabilities. And so during the beginning of COVID, when there was so much uncertainty about how much risk this virus has, we were sending staff into people's homes and into residential programs and trying to quickly develop policies and procedures to keep everybody safe and healthy. And the stress that created in an already stressful environment, because doing the work that we do is really gritty and it's real and it's raw a lot of the times. And we always are dealing with secondary traumatization and secondary stress and compassion fatigue and all the things that influence someone's performance and their well-being.
Right.
And now we have this crisis, and it's not just a 2-week crisis.
Right.
And so absolutely, the impact to our team was pretty profound. We lost people who just did not want to work in that environment because it was so stressful. And of course, as the remote work dynamic started to escalate, we don't have a lot of remote work opportunities in the type
but they wanted it.
But they want it, right? And
They
so
wanted it.
we had to do a lot to stay connected to each other and provide additional supports, whether it was through our chaplain, through our employee assistance program, just really promoting those additional ways of supporting folks during that time.
Did you witness anybody that just their behavior changed dramatically?
Absolutely.
Okay.
We had a couple of circumstances, one in particular that I can think of, where individuals who were perceived as the most stable, solid performers really fall apart and go into crisis that was pretty profound. And so, absolutely, the gamut, but definitely some of that more severe impact we witnessed firsthand.
Hello, everybody, and welcome to Park Duval. My name is Desmond Pritchard. I'm your Chief HR Officer here at Park Duval. I'm located normally 9 times out of 10 at the Wilson location. I'm beyond honored to support our community, to work with our community. There's a lot ahead of us. We have a lot we're ready to do, we're willing to do, and we can't wait to have you on board, to have you doing it with us.
At Park Duval Community Health Centers, we go beyond medicine, breaking barriers to care across Louisville, Taylorsville, and Eminence, Kentucky. From primary care and dental to behavioral health and pharmacy support, we serve thousands, many facing financial hardship. With 7 locations and a bilingual staff, we welcome everyone because PDCHC, your health is our mission. We are Park Duval for everybody, everywhere.
You know, I'm listening to the politics of today. Housing is not a problem. And it's disturbing because you can tell, and I talk to people often that struggle with housing, even though they're working. So we still do not have a livable wage, which is kind of scary.
Working poor, yes.
Kind of scary. So I gotta ask, what do you do for public health?
We have community health workers and individuals who provide outreach, testing, and prevention services for HIV.
Okay.
And so that's an important part of our mission. It's located at the Goodwill Opportunity Campus, where my office currently is. And so that team is out and about trying to reach individuals who are at risk for contracting or spreading HIV, and really giving them opportunities to get tested and get linked into care.
Okay. They should work with my team.
Absolutely, absolutely.
Because my team is out doing it. And I brought in actually a director to help with HIV, since the rates of HIV has been high in that area since the 90s. That's how long I've been reporting on it. So
we still have a lot of work to do.
yeah, we do. So you serve about 25,000 people. How many staff do you have?
We have almost 700 employees when we're fully staffed. And again, a great team that's managing and supporting those of our team members that are on the field and in the field and on the ground.
Right.
So we've got a great management team, and in each of our regions we have an executive leader who's responsible for overseeing those programs and engaging the community and supporting the work that we do.
So that's great. I like to hear that. So you've been in a position 18 years. I'm sure you have accomplished a lot. But before we get to your accomplishments, what did you do the first day you walked in the door?
Oh my goodness, 18 years ago.
18
You want me
years
to
ago.
bring
I want
back
you to
that
go
memory?
back.
Okay, let's see if I can do that. I'm going to be very transparent and say there's not a lot I remember about that day in particular, but what I can tell you about my entrance into the organization is a lot of humility for realizing that I had no idea the scope of the mission, and realizing that I accepted a position for an organization based on a relationship and a promise of what I could accomplish, without being able to fully understand just how expansive this mission really is. And so to walk in the door thinking that I'd done my homework and I understood everything about VOA, and then quickly being humbled to realize it would take me at least 18 months to get my arms around 50 different programs that roll up into these 7 divisions across 4 states with lots of different moving parts. So I just remember being really overwhelmed by the opportunity to serve. I was doing business development and government relations, and so trying to figure out what that even meant in the context of this mission, because it was pretty complicated, all these different programs. So that's really my first memories, is just being pretty humbled by the role.
That's a good memory, because usually, you know, I would equate it to, I went to Africa for Ebola, and I did an assessment of Senegal, right? So I spent probably about a month. And when I arrived, I'm like, I'm trying to validate the information about the environment, and it was quite different when I got there. So as CEOs, you usually spend probably about 30 to 90 days doing the assessment, thinking about strategic planning, vision and mission, where you're going to take the operation. And then you arrive, you're like, this is a lot more grandiose than I thought. Right?
Yes.
So it is a humbling experience, but it also makes you realize you got to do the homework.
Yes.
Right?
Yes.
So now you're in a position, right? And you realize you have to learn what's going on.
Yes.
At one point, did you create your vision once you got your hand on it?
I knew after about a year that there was a program we provide to the community for women who are pregnant and parenting and substance use disordered that allows them to bring all of their kids into treatment. What a gift to serve that whole family together. That's a program that's called Freedom House. And I was visiting Freedom House. I was in the program, meeting the staff, seeing the clients, understanding the outcomes. I'm like, why don't people know about this? We should be celebrating that this is a place where families get to stay together and heal together and be treated together. It's primary prevention for kids who have been exposed to all sorts of trauma associated with their parents' addiction.
Right.
And then we get to treat mamas, and they're willing to come into treatment often because they get to bring their kids, and there's not that separation of that maternal bond, which is
That's a great
huge.
program. That's a great program.
And so as I realized that a lot of lawmakers didn't know about this, we hadn't fully articulated the return on investment because of the cost savings we're able to realize for the state. So I began working quickly to figure out a plan to amplify that program's message and get people more engaged. And frankly, if I could think of one thing that I've done consistently for 18 years, it's been telling the story of that program and other programs, but in particular that one, because it's so compelling and it's so needed. As the opioid crisis, after the crack cocaine crisis, and then we had the opioid crisis, and now we're into all sorts of polysubstance use in this community and elsewhere. The problem hasn't gone away. More people have been impacted, and certainly to deliver this unique service that specializes in taking care of whole families is something that we're really proud of, because we know firsthand the fact that it's saving lives and keeping families together.
So 18 years, what keeps you motivated and engaged?
I just celebrated 10 years as CEO in April. And a lot of people ask me if that was some kind of milestone that might get me itching to start thinking about doing something else.
They always ask that question.
And I know, right? and it's interesting, because I hope I've convinced folks when I've been asked, because the truth is, I don't even have that like glimmer of a thought. When I'm driving around town, I'm not thinking about, oh, I'd rather be doing this or that. When I get going in the morning, I can't wait to get started. I get to do so many fun and different things. Coming here today, I've got a totally different schedule tomorrow than I do today. So the variety of what I get to do, the meaningful impact of what we do that I get to be part of, I can't imagine any other situation that would be as fulfilling and as engaging as the work I get to do. So I think it's a lot about the people I get to work with and be part of, the clients that I get to see firsthand transforming, and the relationships that we build with those individuals who often come back to serve on my board, to work as my colleagues. So that is a community that's really powerful. So to get to be part of something like that for as long as I've been here is really special.
Tune in to CEO Live Talks with Dr. Swannie Jett every Saturday at noon on Wave 3. In this thought-provoking series, we bring you conversations with influential leaders, visionaries, and changemakers who are making a difference in their communities and beyond. From healthcare innovation and public health initiatives to community building, each episode offers a unique perspective on the challenges and opportunities we face in today's dynamic landscape. Join us as we explore the stories and insights of these inspiring individuals and gain valuable knowledge that can drive positive change in your own life and community. Don't miss an episode. Mark your calendar for Saturdays at noon on Wave 3 to watch CEO Live Talks with Dr. Swannie Jett. Together, we can shape a brighter, healthier future for all. So what is probably the worst scenario that you have seen and two youth had to sit across from each other and try to restore the relationship or make amends?
Unfortunately, it's a situation that occurred to Volunteers of America from one of our own staff.
Oh, wow.
Where we offered an opportunity for this person to participate in restorative justice. And unfortunately, they declined, but they committed a pretty serious crime against the organization. And it was someone who was in a position of trust, who had been in the organization for a really long time and had a lot of power and influence that was misused and exploited for that person's gain, and the organization was deeply harmed. And unfortunately, we have had to go through a very lengthy legal process to remedy that and resolve and bring that to its conclusion, and it still hasn't reached that point yet. And so we have now experienced the experience of so many of the clients that we work with where there's been direct harm made by one of our own. And unfortunately, we didn't get to go through that process and complete it with that person, but I'm really proud of the fact that our board and all of us agreed that we wanted to extend that opportunity, that we wanted to live our mission and not just talk about our mission and do it for certain people, but do it for all of us.
But an individual like that, though, you really don't want them around once they do harm to others.
Yeah.
So you have to hurry
There
up and
has
get
to
them out the
be
building.
accountability, and accountability was swift in terms of that person not working for the organization.
And probably the victims didn't want to have anything to do, even though it's a good gesture to see a person in the face,
Right.
but they might relive experiences.
Yeah, we have to be really careful to not re-traumatize the people who have been harmed. And so we do a lot of pre-conferencing work with the victim to get that person ready, because the other side of the re-traumatization coin could be a real sense of healing and empowerment to be able to face the person that has harmed them and to get to talk about what it means. Otherwise, the criminal justice system, it's the Commonwealth versus the offender, and the victim really doesn't have a say at all in what justice even looks like. So for those victims who want to participate, it can be just quite a therapeutic healing opportunity for them to get to have direct amends made to them.
Yeah. Well, I thought about that during the P. Diddy trial.
Yeah.
And watching Cassie.
Yeah.
And I don't know, because it seemed like she relived a lot of things.
Absolutely.
And then the whole world had to hear.
Absolutely.
So,
Yeah.
and forever they're going to be talking about that.
That's right.
So
Yeah.
I don't know.
I started my career at a rape crisis center and did legal advocacy for victims of sexual assault. And the dilemma individuals of sexual assault who have experienced that face is the criminal justice system having to go public and to retell, and oftentimes to be scrutinized and shamed, is more traumatizing, can be, than the experience itself. And so a lot of people decline prosecution because of that, and I can't say I blame them. We don't want to expose people to more trauma, and I think the example you just gave is such a poignant one, because to have her have to sit there and to retell and walk through in front of such a global audience, her courage is just amazing.
Oh, it's amazing. And to be critiqued.
That's right.
And to bring out all the other people that she dealt with. I just felt for her.
Yeah.
But I'm pretty sure it healed. It's caused something to the family as well. Her husband, kids, and some they have to live with.
That's right.
What's next?
Yeah.
What's next for your operation? What's the next greatest thing?
Well, we are in the middle of a $75 million development in the Smoketown neighborhood.
Okay.
So it's interesting because we started this conversation talking about Smoketown and my roots there and how amazing and special it is for me to get to be part of developing a campus in Smoketown that's the future home to our headquarters, that is going to be where healthcare, housing, and services come together. It's a whole city block, and we're transforming it into affordable housing, medical respite beds, emergency shelter for unhoused families, transitional housing. There's so many different ways that we are going to serve this community in Smoketown. And I'm really excited that VOA gets to be a key part of developing this campus and bringing it to the city.
When is the groundbreaking?
Well, we are in phases and stages because it is so comprehensive. So we actually are under construction now, and by the end of this year, we'll open a family shelter that is the second family shelter we provide. So we already serve unhoused youth and their parents. We have about 85 kiddos and their parents living with us today, and do all the things that we're all thinking about in terms of back to school. And so that's an important population that we've been taking care of in this community for 40 years. Well, there's more unhoused families than we have capacity. And so the first phase of the project that opens later this year is going to be focused on serving those families who need access to emergency supports. We're already on that campus today providing a temporary shelter for about 13 families, but once we get the new structure renovated, then we'll have space for almost 30 families to be served there.
And what's the location?
And the location, the boundaries are, it's Breckenridge, Brook, and Floyd Street. So it's right there in the heart of Smoketown. And we are thrilled that we get to do this project in partnership with the city of Louisville, of course. This is part of Mayor Greenberg's vision that we're helping bring to life. And our team has been working really, really hard to bring so many partners to the table to reimagine what that space can be and to make sure that part of what we're doing there is building a continuum of care so that as folks come in an emergency shelter, they can matriculate into transitional and more permanent housing so that, again, we're creating those long-term sustainable solutions. We are not a Band-Aid organization, so we're really looking at getting to the heart of what it takes to help people transition into more self-sufficient lives.
And I love it because it's a public health approach of building community, building infrastructure, and helping people meet them where they are. So we have been collaborating with you.
Yeah.
So I look forward to collaborating with you on this project. If you need anything, let me know.
Thank you.
It's very special that you're here and somebody from Louisville, because we had a conversation last night at the Kentucky Derby Festival Board of Directors that usually a lot of people making change come from outside the community because they are visionaries.
Yeah.
But you have great vision, so I appreciate you being in Louisville and staying in Louisville.
Staying in Louisville. My heart is here.
Your heart is here. That concludes my show for today. Hopefully you appreciate every word of this beautiful young lady. Again, my motto is dedicate your life to a cause or a mission that will outlast you. Have a great afternoon.